All right, so I wanted to go over this very viral Kylie Jenner TikTok comment where she describes the details of her breast augmentation procedure. She goes over the size of her breast implant that was placed, the shape of it, and also where it was placed. And that's leading to some confusion because where it was placed, she describes it as half under the muscle. And I've gotten some questions from patients about what is this half under the muscle thing? How can you place an implant half under the muscle? I don't get it. And so I'd like to explain that. So when we're doing a breast augmentation procedure, we need to decide on where to place the breast implant. And we have some options. So on the rib cage, you have your pec muscle, and then you have your breast gland sitting on top of it. So you can place the breast implant completely behind the pec muscle in a submuscular implant pocket, or you can place it in front of the pec just behind the breast gland in a subglandular placement. Now, both of those pockets have their pros and cons. In the submuscular pocket, what is nice is this implant is behind this very thick, kind of robust pec muscle, and what that does is it hides a lot of the implant, that upper pole shelf, that distinct roundness, that bolted on look like that, where it's very round and noticeable. That pec muscle is very thick tissue, and it kind of hides that in a very good way. One of the drawbacks of a submuscular placement is animation deformity. If a patient will move their arms or flex their chest or do that to some degree, the pec muscle will contract and will push on the implant and either push it down or ride it up. It moves, and patients don't really care for that animation deformity. So let's not place it behind the muscle. Let's place it behind the breast gland itself, okay? Well, there are some drawbacks of that. So a lot of patients don't have a thick enough breast gland to hide the implant. A lot of patients who want the breast augmentation don't have a lot of breast tissue to begin with. So that implant can be kind of noticeable. You can see that upper pole shelving. You might see some rippling if you use the wrong size implant, but you don't have any animation deformity. So there's trade-offs between the two. So is there a nice middle ground? Is there a compromise between the two? Is there something that has the best of both worlds? Well, about 25 years ago, Dr. Tebbett in Dallas, Texas, kind of decided that you can have that. And he came up with or popularized what he called the dual-plane augmentation. And what that is, and to understand that, you kind of need to understand some chest and breast anatomy. So you have your pec muscle, and then you have your breast gland. And those two, the pec muscle and the breast gland, have attachments between each other. They're actually attached to each other. And those attachments dictate the behavior of the pec muscle and the breast gland. It's kind of like a symbiotic relationship, okay? So what he realized was if you detach the pec origins from the inferior aspect around the breast fold, and you incise that and you release the pec muscle is kind of under tension, and if you release it from its origins, it will kind of spring up. It wants to kind of relax, and it will pull up on the chest, kind of like when you release a window shade like that, okay? But what you need to keep in mind is the breast gland is attached to that muscle. So as that pec muscle ascends, it pulls the breast gland with it to some degree. Now, these attachments aren't super strong, so the breast gland will start to descend off of that pec muscle like that, okay? So you do get some breast gland descent and coverage of the implant, and that technically is a dual plane augmentation. But what Dr. Tebbett described is if you have your pec muscle and your breast gland together, if you dissect between that plane, between the pec and the breast gland, and you separate them, not only do you see changes in where the breast gland sits, you actually also see changes in what the pec muscle does. And what happens is, as you start to separate to various degrees, and there are various grades of a dual plane pocket, and what those are dictated by is how high you dissect the breast gland off the pec muscle, either the inferior border of the areola or the superior border of the areola. What will happen is the breast gland will descend more, but not only does the breast gland descend more, the pec muscle will actually ride up higher on the implant. It ascends on the chest more as you separate those. So what you get is the pec muscle will probably sit somewhere on the top shelf of the implant, and the breast gland will descend over the bottom half. So you have a breast implant covered by muscle and breast gland, essentially acting like the implant was placed in two separate pockets at the same time. So this is a dual plane augmentation. Now what the benefits of this are, is you see less animation deformity, because as you release the pec, it starts to cover less of the implant, but it still covers the upper pole, which is pretty much the crucial point. But then the breast gland descends over the inferior aspect, and what you start to get is that breast gland fills out the bottom of the breast, and you get this really nice natural teardrop appearing natural breast that you really wouldn't get in a fully submuscular implant pocket. Okay, so you get kind of the added benefit of thick tissue coverage by the muscle and a nice drooping spread out breast gland in the bottom. Now what is also important to remember, and very, very good benefit of this technique, is that as you release the breast gland will start to sit lower in the breast, and it will start to push. It will start to push up the nipple and areola complex, and it can kind of give a lifting effect, not to a very significant degree, but 2, maybe 3 centimeters. And so that can really help with patients who are on the border of needing a breast lift if they just get a dual plane augmentation. Sometimes you can get away without having to do a lift, a full formal mastopexy with the scars, the inverted T anchor scars, or the vertical scar mastopexy. So you can kind of get away with that. So that is what a dual plane augmentation is, kind of best of both worlds. I use this technique all the time, whether it's in the inframammary incision under the breast. You can also do it through the armpit in a transaxillary or an endoscopic breast augmentation, which I've discussed before. You can do that. So you can get a nice, beautiful, natural looking breast augmentation with no scar through the implant, or if you use the inframammary scar, it still is a beautiful result. Less animation deformity, more breast gland over the inferior pole. It looks better, looks natural. You might even get some of the lift out of it. It's a beautiful technique, and I'm a big fan of it. I do use it quite frequently in my breast augmentation procedures. So that's what that is. That is what Kylie Jenner was talking about when she was mentioning that her breast implant was half under the muscle.